The Coalition of Texans with Disabilities, Raise Your Voice 2022, Looking Ahead to 2023, November 21st, 2022.
I'm Jolene Foster. I'm the Advocacy Director at CTD. I do have my camera off today because I'm joining you from my 4-year-old's bedroom. My entire house is sick, and so I'm isolating myself. On the screen is the CTD logo in lieu of my face. So as you may know, if you've joined before, and if you haven't, my primary focus in the policy world is on issues impacting children and youth with disabilities. And so as you can imagine, thinking about across the lifespan, special education is a big issue, and it impacts, our kids from birth until they graduate. And so special education is definitely continuing to be a priority for CTD and our partners. If you did join the session on the many ways that Texas is failing our children and youth, you know that I did mention the funding weights for special education, a bill last session, HB 1525. Part of that bill formed the Commission on Special Education Funding to really look at something that hasn't been revisited in over 30 years. And that is how we fund special education. And those recommendations that are coming out of that commission hopefully will lead to some really meaningful change where we are actually funding service array and service intensity rather than the actual physical placement of students. So that's number one, something that we are going to be very heavily involved in. When we think about early childhood, we think about a couple of things that have a great impact on kids with disabilities. Early childhood intervention, or ECI, for babies and toddlers 0 to 3 and who have a developmental delay or disability or other medical condition. So we will continue. This is kind of a perennial issue, right? We do this every session, but continue to look at increasing funding for early childhood intervention. It has not kept up with inflation, and as some of you may know, we've hit several barriers since 2011, where we have seen funding cuts, rate cuts for Medicaid reimbursement for therapies, the per child allotment, the narrowing of eligibility. And that has all resulted in a number of providers dropping out of the program and saying, we're not going to provide ECI services anymore. So those two top budget items. Other than that, some other things that we've talked about previously and that are on the horizon. Fortunately, a number of items have already been pre-filed. Pre-filing started on November 14th. And we're really excited to see some of our priorities get that attention early prior to the actual first day of session. One of those is inclusive childcare. Representative Mary Gonzalez has refiled the inclusive childcare bill that we've been working on, that would clarify the requirements for providers to comply with the Americans with Disabilities Act, to work alongside ECI providers within the natural setting in the child care center. There's also some training components and some non-discrimination language within that bill, because we know that kids with disabilities have a difficult time. First of all, their parents struggle to find a program that will take them oftentimes, or to stay there. So we see a lot of kids with disabilities getting dismissed. Some other priorities have to do, I think this is going to be the biggest one, and this is kind of where Jen and I, our policy issues tend to cross over quite a bit, is keeping students with disabilities safe. We're going to be focusing very heavily on restraint legislation to completely reform restraint to keep kids safe. We're also going to be focusing on revisions to the cameras bill that was passed several sessions ago to allow for cameras to be placed in self-contained settings on campus. We are also going to be looking at the Do Not Hire registry, and that's a registry that was created, geez, I can't remember what session now. Chris, maybe you know, 3 sessions ago.
Yeah, 3.
Yeah. Okay.
That
And
was the last update, maybe 4 when we first passed it.
Yeah. So we're going to be looking at revising that to ensure that in addition to those folks who currently are being considered and being listed in that registry, we're clarifying also those who cause harm to students with disabilities. And then we're also going to be looking at clarifying language in the penal code around use of force on kids with disabilities. It's very much kind of a blanket immunity clause right now. And then one of our big priorities, Representative Alma Allen has refiled again what we often refer to as the early pickup bill. And this is the kind of informal practice that of schools calling parents and saying, hey, I need you to come pick up your kid. We don't know what to do with them, or we're having some disciplinary issues, or as the example I've given a million times, hey, you know, Chris is having a really good day. Come pick him up right now so he ends on a good note. That's gonna, you know, that's gonna support him in feeling successful. What we see and what's happened across the country, it's not unique to Texas, but we're hoping Texas will really lead the way on this, is this practice of shortened school days or early pickups that keep kids with disabilities specifically out of the classroom. There have been a number of studies about the harm that it does at calculating the amount of time that they have actually missed and how students fall behind. It also has the unfortunate consequence of, excuse me, becoming an attendance issue where families are getting truancy notices and there's nothing that they have documented that they can back up that, hey, I wasn't just keeping my kid out of school. This was a school initiated pickup. So Dr. Allen's bill would actually prohibit that practice unless it was actually a documented suspension or expulsion by the school. This is obviously not an exhaustive list of education and child welfare related policies that we're going to be working on, but just kind of some high points. And we will continue to keep everybody posted as we start Raise Your Voice in the new year, which is really hard for me to even think about right now. It's about to be 2023. With that, I will turn it over to Jennifer Toon.
Thanks, Jolene.
I am
my
the
name
policy
is
fellow
Jennifer
here
Toon.
at CTD. I'm an attractive, middle-aged white lady with glasses, short hair. I've got a blue checkered flannel on, which I'm looking at Chris right now, and it looks very similar. Great minds think alike. And in the background is a fierce painting of a lion. So I'm really excited to be here. And I just want to talk to you a little bit about what my policy priorities will be in the upcoming session. A lot of overlap, of course, as you heard with Jolene, with the education system. And Jolene, did you mention no kids in cuffs? Because I have it at the first top of my notes.
I did not.
Okay.
I left that gem for you.
Okay, good. I was like, I don't know if I missed it or not. There was a moment the cat had done something distracting. So no kids in cuff. That will be working with Representative Hull's office. It's already been refiled. And this bill would prevent children who were younger than 10 years old from being handcuffed and maced with chemical restraints. And that is a thing. A lot of people, when we educate them about the stuff in the justice system and the education system, they did not know that children were handcuffed. Children is younger than 10. So this would be a fantastic bill. And we've got good support for it. My priorities are going to be criminal justice overall. I will be looking at things in the adult system, but with a heavy focus on the youth system. County jails, releases within TDCJ, and I'm sorry, the Texas Department of Criminal Justice, And of course, if you were on our other calls, some legislation for a staggered closure plan of the 5 state facilities in the Texas Juvenile Justice Department, known as TJJD. A lot of acronyms, but in the criminal justice system, TDCJ is the adult system, TJJD is the juvenile system. Some of those bills in the adult system, we're going to get our family liaison bill. Y'all might remember that from last session. Representative Johnson's office is going to refile that for us, and it will call for a family liaison to be appointed at all the county jails, which means when something happens, some serious emergency medical issue happens, that staff member is responsible for making sure that anybody that is on a person who's detained medical release is contacted immediately. If they've been transported to the hospital, if there's been some other type of medical emergency. And the reason this bill was, the reason why this is an issue is because many times county jails were not notifying loved ones, even if they were on the medical release, that someone had been transferred to the hospital. One case in Bowie County, the lady was transferred to county hospital where she died, and her husband repeatedly called the county jail with no answers. Nobody knew where she was. And there was just nobody held responsible for making sure that information was shared with loved ones. So excited about that bill. There's some other bills concerning release that are super important in the adult prison system. There will be one with Representative Johnson. It'll be about medical recommended intensive supervision, also known in other places as compassionate release, but we don't use that term in Texas. It is a medical release. And what's interesting about this bill is that we looked at this issue last session, even though there wasn't really a bill around it, but I'm really excited to see that it's gaining momentum here, is because medical parole, you have to be recommended for it. So you are eligible for parole, but they have to recommend it based on serious mental health, extreme, physical disability. And of the I think it was 2,000 that were recommended, only 40 people were approved. And this was, I believe, right before COVID, and it was even worse during COVID. So we saw a real problem trying to get out the most vulnerable population, in terms of COVID and other medical issues. It's just a nightmare trying to get them out into the community, into community care. We'll also have another bill that's a refile, and it's regarding parole and release to make sure that TDCJ is using individual treatment plans, making sure that it's very much more like a case management system than the roll of the dice that we have here currently with parole. Some other things, I'm looking on my list, there's so many. There's so many criminal justice stuff. And as we know, disabilities is often left out of the conversation almost completely when it comes to criminal justice issues. I know that me and Jolene hope to hear back from, I believe it's Representative Zaffarini's, our Senator Zaffarini's office about supportive decision-making. What we'd like to see is a bill that specifically states that this applies to legal decisions as well. We've seen people struggling while they're on probation or parole, not being allowed to have their supportive decision maker or a guardian with them as their officer is explaining things, or they have to make decisions because they just don't understand what supportive decision making is in that system. And there's so much. We're working on some stuff to raise the lower age for children in the justice system. So that means that in order to be arrested and detained, a child would be 12 instead of currently it's 10. So we want to raise that lower age to 12. And then we want to raise the higher age to go into the adult system from 17 to 18 years old. And most importantly, I will be working heavily on the legislation that Representative Tallarico will be filing soon about the Texas Juvenile Justice Department closure plan that many of us in the other advocate groups are working heavily on. And again, if you were on our other calls, we talked about what that would look like, and just a staggered plan to close these 5 state facilities that have over 100 years of neglect and abuse in very rural counties that don't have the type of staffing or support that they need to be doing the type of care that these kids need, and to finally start finding ways to treat kids who commit crime as a public health issue versus a criminal justice issue. So I could go on forever and ever about all the ways that they're going to keep me busy this session, but I'm sure I'll be able to share that with all of you as the process gets started in January. So I will turn it over, I think, now to Jay.
Thank you, Jennifer. Howdy, y'all. My name is Jay Consiglia. I am a talking black square because I am very shy. I'm standing in for Dennis and Chase today. Chase is out, not feeling well, and Dennis is in Antarctica right now. So I'm a new hire from CTD. I joined the team April this year, and what my focus has been on the entire year has been healthcare. I was specifically hired to focus on raising community attendant wages and dental benefits. Now, where community attendant wages is at, we've already had some raise your voices about this. We've been sending out various emails and mailers and flyers throughout the year about this issue. We've been very vocal about making sure that the problem with low community attendant wages is addressed in the upcoming legislative session. You've probably seen something about it. Dennis has been in a couple of news articles. He's been on TV talking about it. We're really trying to seize the momentum that seems to have been, the next legislative session seems to be kind of ripe for making an actual change in this regard. You know, CTD has been advocating in this area for years, but every year, you know, we put forth the effort, it doesn't end up happening. Well, this year we've made some key allies in the Texas legislature, you know, really brought them over to our side. So we're really hoping to raise that base wage from $8.11 an hour to $15 an hour minimum for fiscal year 2024. So there's actually a bill that has just been filed, HB 245, by Mary Gonzalez, that would raise that wage to $15 an hour, putting it into the code. So we're going to be paying really close attention to that. And we're hoping that we can actually find some success in that area. Because if you're not familiar, you know, community attendants, they provide an essential service, a vital service for people living in their homes that have significant disabilities regarding acts of daily living. Community attendants come in, they help them eat, they can help them bathe, they can help them around the house, they help them get in and out of bed, they can help them take medication. It's extremely important work that they're doing, and we're facing a kind of workforce collapse because of low wages, because of no benefits. So we're really hoping to stem the bleeding with action in this upcoming session. So that's going to be that's my number one priority, is that particular issue. Regarding dental benefits, there actually was a expansion of dental benefits in the Medicaid system for adults with disabilities that was codified in legislation, but it had a Nelson Amendment attached to it. And what a Nelson Amendment is essentially saying, okay, well, it's the program's been expanded, but the legislature has to actually vote to fund the program. So we have to advocate for this expansion to actually be funded. There has been, it seems like, some momentum in the House in this regard. A number of representatives are like, we passed this bill. Why aren't people receiving Medicaid that have disabilities? Why aren't they getting dental benefits? This is ridiculous. So we're hoping to kind of latch onto that and get that funded, but I haven't seen any bills really related to it, but it's not really, it really wouldn't be added in legislation. It's already legislation. So either way, it's something that we're going to be paying attention to. The three other areas that I am focused on are healthcare outside of the Medicaid system, so more private insurance. So things like copay accumulators, which, if you're not familiar, is when, you know, say you are getting a drug from the pharmacy, or you're getting, in my case, I get infusions every 6 weeks for my Crohn's disease. So I go to my infusion place and I present them with a copay card because I can't afford to pay $600 every 6 weeks to get medication. So right now, current practice in the private insurance space is if you use a copay card, that money does not actually contribute towards your deductible, because insurance argues that it's like double dipping. But they're still getting paid. So we're trying to not allow this practice, because it essentially allows insurance companies to double dip into copay assistance programs as well as the patient's pocket. So we're trying to make some headway in that regard, but I haven't seen any bills related to it. And it's not really been a part of a lot of the healthcare conversations that I have been having with people in the legislature. I'm having a lot more conversations related to non-medical switching, which is the practice of a patient being on a drug, they're stable on that drug, and then the insurance decides they don't want the patient to be taking that drug anymore. They want them to switch to a cheaper option, which in the field is called practicing medicine without a medical license. So right now in Texas, you can't be medically switched in the middle of your plan year, but you can be when plan years roll over. And we're trying to make it so, you know, if you're stable on a medication, you stay on that medication. So Coalition for Stable Patients, a lot of other healthcare advocates are really working hard in this regard to make sure that patients stay on the medication that they need. The last sphere that I'm personally working with is in the medical cannabis sphere. The Texas legislature in this upcoming legislative session seems to be of the mindset that it's time to expand the Texas Compassionate Use Program, which is the program in Texas that allows people to access medical cannabis. So it looks like, you know, the legislature is prepared to include more conditions, to increase allowable THC content, which is great because there's a lot of conditions that are excluded from the program that are included in other states that have been clinically shown to benefit from access to medical cannabis. So that's an area that I'm strongly advocating for and as well. And it looks like we may actually be able to make significant headway in that area. We're also, outside of legislation, we're meeting with a number of the licensees in the state of Texas to advocate for offering wider arrays of products. And we're going to be releasing a piece soon on kind of the medical cannabis landscape in Texas. That's just a quick plug. I figured I'd mention that. Now, one area that CTD is always focused in every legislative session is voting rights, voting accommodations, voting accessibility. This is more Chase's sphere, and it's not an area that I have worked in, but I wanted to let everybody know that this is something that we're also going to be paying very close attention to. And there has been quite a few bills filed in this particular area. So it's something that we're going to be looking at and keeping a close eye on. And I'm sure that, you know, CTD will be distributing any information regarding advocacy actions should the time be right to do so. And with that, that's kind of all my things. I don't know, Chris, if you would like to talk about anything that you've been noticing or areas that you're working in.
Yeah, definitely. Hello, everyone. My name is Chris Macy. I'm a former CTD staff member, and I'm helping out with bill tracking this session. I am a white male. I also look exactly like Jennifer Toon in that we are wearing glasses. We have short hair and a blue checkered shirt, although I do have a beard, and Jennifer does not have a beard. I ran through and looked at every bill that was filed. There were over 1,000 bills filed. Twinsies, I see. There was over 1,000 bills filed between the 14th and today. So within a week, the number will trickle off, and then it'll raise up again as we get past the beginning of the year, and there'll be more bills. That's about an eighth or so of what we typically expect. We usually expect around 800 bills. CTD takes a broad look at tracking bills, and that, sorry, folks, that's my fault. And we're tracking over 300 bills right now. Usually we end up with about a third of the bills posted in any legislative session that we track. Most of those are not going to move. They're not going to do anything. Some of them are even being filed just to make a statement. So quickly, I'll go through just a few trends and just that. There are passionate reps, not so many senators, but mainly representatives in the House who posted lots and lots of bills, with the exception of Senator Zaffarini. She's posted quite a few as well. Again, CTD's tracking over 300 of those. The big issues, as we just talked about, the voting, and Laura put it in the chat, 73 bills already on voting. There were 344, I think, last session. Most of those bills on voting don't go anywhere. The representatives are, and this is usually the representatives in the House, are kind of jockeying for position and for having a piece of the conversation. So they may even file, as you may see, identical bills on the exact same voting issue. There is one bill specifically adding rights for people with disabilities in the voting area by Representative Busey. That bill didn't go anywhere last session. However, some of the concepts in it were included into the other bills that were passed. And so we're hoping for more protections, of course, for people with disabilities when it comes to voting. Medical expansion is one that, Medicaid expansion, not medical, pardon me. Medicaid expansion, there are so many different bills filed about that. And some of the reps have decided not to even use the name Medicaid expansion. They've coined it as something else, but there's multiple bills, and we'll see how that goes, but there's nothing in the Senate referring to that, I don't believe, or if it is, it's only one or two. It's mainly in the House. Jolene said there's a lot of special education bills on the Allen, and of course, we can't talk about any disability issues without sending out all of our kudos to Representative Mary Gonzalez, wonderful representative and champion of the community. The marijuana bills, there's over 14 of those. Some of those focusing on decriminalization. They're not necessarily focused on cannabis themselves, but taking away the potential for someone going to jail for possession of small amounts. And there's a ton of bills on tax breaks for property taxes, tax breaks for all kinds of things, which lead into my next session. There is an effort to change school funding with tax breaks to eliminate some of the burden of an individual tax that for your property taxes that I don't know how it's sustainable. There's bills to take away funding for all of school, but no bills to actually put some in there. So I'm not really sure what that's about and how that's going to work. But there's definitely, as I've said, there's a clear definition on some of the Republican issues and some of the Democratic issues that the Ds have a focus on Medicaid expansion and voting, and the Rs have a focus on tax breaks, among some other issues. Some of the really interesting bills, y'all already mentioned the Mary Gonzalez bill about raising attendant wages up to $15 an hour. Thank you, Mary. There's a respectful language bills, getting rid of the R word. That's a personal and passionate project of mine. There are still codes out there that use the word retarded, and we've passed the bill years ago to have that code swept. And these bills have been filed before. However, I do not think that Representative Craddock has ever filed a respectful language bill, and we'll definitely be reaching out to his office and thanking him for that. I believe it was, again, one of Mary Gonzalez's bills from last session. School funding, again, very opposite concepts of what school funding should look like. And as Jolene mentioned, very contrasting ideas of what school safety entails. Whereas a lot of the Democratic bills are focused on trying not to harm kids. A lot of the school safety bills are really focused on more punitive and difficult punishments. I think that's it. Of course, there'll be more bills filed, and many of those will be from some of your CTD staff and others, but that's kind of an overview of where it's at. So I'll turn it back over to Laura.
All right, welcome back, everyone. Hope that wasn't too abrupt. As always, as it is with the breakout rooms. We're right at 3 o'clock. So I wanted to quickly thank our sponsors who allow us to keep doing this program, make it free and as accessible as possible. Those are, we work for Health Texas, GRAIL, Gilead Sciences, AstraZeneca, Amgen, Touch of Class, AbbVie, and then the big one, Superior Health Plan, United Healthcare, BristolMyersSquibb, and Amerigroup. So if any of y'all want to stick around, some of us will be sticking around for a while to continue asking questions, having what I assume were very lively conversations in your breakout rooms. We'll do that. And as far as Raise Your Voice into 2023, we are still figuring things out. You'll be hearing from us as soon as we have some dates and topics set. We might be reaching out to get your input on what you want to work on and get involved in. So you'll be hearing from us, and that's as far as we've gotten.
The service animal pill.
It looks like, Chris, there's a request to talk about the service animal bill, if you wouldn't mind.
It is HB 720 by Representative Carl Sherman. And I'm never sure if Pastor Sherman or what you should use as his moniker. This bill has a companion from last session. I don't think it went very far last session. Let me see. No, it did get a committee hearing. And I will tell you what it's about. Oh, it's the one for making sure a child or a person with a disability can bring their therapy dog into criminal proceedings. And so that's one that I thought would be a no-brainer and slide through last session, and it did not make it. So y'all may or may not be familiar with that one. But this one is going to be, it's a refile. It again seems like this one should pass fairly easily. If there are any more on service dogs, Kenneth and Pat, I will make sure to make that once we see them, that I'll have Chase or Dennis or myself go ahead and send y'all some information on those, so you won't get lost with it.
Would you let me know as well? This is Belinda Bourne,
Yes, ma'am.
because I'm gonna work with Pat and there's several of us from the American Council of the Blind we have a Dog Guide Users Inc. Group of Texas who are interested in this bill.
Okay. I'll make sure and get it to at least Kenneth to start off with and make sure that we move on.
Well, if you get it to Kenneth and Pat,
Yeah.
I know Pat will get it to me.
Okay.
Hey,
So
Chris,
that's
this is
fine.
Kenneth one more
Yeah.
time.
Yes, sir.
Dennis and Chase and Laura have received a resolution that came from the American Council of the Blind of Texas. We have missed each other, Dennis and Chase and I, because of travels that they've had in the past few, even last month or so. So sometime we got to talk briefly, but we never got on this one as much. And so I sent that so that they can have that to access, because CTD was mentioned in the resolution that was adopted by the American Council of the Blind of Texas.
Good.
And so we'll be in touch. I just want to give you that heads up. Okay.
Sounds great.
Good afternoon, Kenneth.
Good afternoon, Ted. Okay, now Chris, did the other question get answered by the other lady that sent in our meeting? I think I don't know if she's still here.
That was from Deborah, and I'll just briefly, I don't know if y'all can see that from the chat, but Laura, Deborah had quite a few comments here. Laura will have those and she can send those to Chase and Dennis on the further ones down the list. But I can reference the fact that as far as any legislation directly dealing with Uvalde, if there has been any, I haven't seen it. There are some mental health and emotional health bills, but I don't think I saw anything that directly dealt with Uvalde. Not to say that there won't be. I think there will be.
I mean, there have been lots of bills filed around access to firearms. It'll be interesting to see if we actually do fund. Chris, you may remember the big mental health in schools legislation from, I think, like 3 sessions ago. I anticipate that'll be, that'll definitely be at the table. And we have lots of partners who are revving up for that as well. I think, Chris mentioned before, it's interesting how very divided the parties are in approaching this. It's either school hardening or providing preventative and, responsive support for students. I think one of the things that we just really that CTD will be working on is making sure that whatever does pass is not going to inadvertently scoop up kids with disabilities and make it even more difficult for them. For instance, looking at threat assessment criteria. So if I'm a 5-year-old and I say, I'm gonna blow up your house, am I really going to? Do I have the means? Do I know what I'm saying? Am I repeating something that I heard in a cartoon or, on TV? So just really more, I think a lot of defense, as well as ensuring that, additional mental health and behavioral supports and social workers in schools, that's good for everybody.
Laura, one thing, if I can add, one of the things that concerns me about counselors in schools, and I think this may be being addressed at some level, is the number of hours that counselors actually spend doing class scheduling and that kind of stuff. They're not doing the kind of counseling that students may need. And I'm wondering if there ought to be some kind of way, I don't know how the schools would pay an additional staff position or whatever, but there really ought to be a counselor, LPC,
Mhm.
psychologist, somebody that is actually paid to do counseling only and not just do, so many hours of counseling and so many hours of scheduling and other administrative kinds of things.
Yeah,
That
no,
really concerns me about, because the problems start at school and they move on to adulthood. They start at home and they move on to the school to adulthood.
yeah, 100%. And I mean, there has been legislation to kind of limit the percentage of time that counselors spend on non-counseling activities, because we know that they're often used to fill seats in other areas or to proctor tests. And I'm 100% with you, Glenda. And when we think about counselors, what are we talking about? Are we talking about counselors who are like education and career counseling for post-secondary opportunities and scheduling and things like that? Are we talking about real counseling for mental health or behavioral health, or to provide those kinds of supports within the school setting? Because you're right, in school is the hardest place for, I think, most of our kids. It's absolutely the hardest place. And yeah.
Well, I think there's a difference in educational counseling where you're doing testing to find
Mhm.
out interests and place in a school, a post-secondary appropriate working, but I just think that it's because all of that can get into some counseling issues too. How do you meld those kinds of things and not just scheduling, well, at 10:15, this class is available and that class is available. And,
Yeah.
how many hours do you need to graduate and yada, yada. That's an administrative kind of thing. That's the stuff the principal's office ought to be doing, not the counselor.
Yeah, no, absolutely.
But anyway, I don't know what we can, how we can impact any of that, and probably maybe not this session, but sessions in the future. Somewhere it's got to be addressed, or these kinds of issues are going to keep coming up, and they probably will keep coming up. But at least we can have the resources available to help deal with them.
Yeah, no, I agree. And Chris, I don't know if you have anything else to add, but I know that things like social emotional learning and mental health, and when we start talking about those things, which we know are very important, critical, there are some legislators who want to restrict the kind of curriculum that's being taught, the kind of
Yeah.
books that are they're also wanting to restrict access to things like sex ed and mental health, allowing kids to access or to authorize or provide consent for their own mental health to go see counselors. So there's a unfortunately, there are those legislators who are like, we want this to be the parent's decision. And
My
it's
kid ain't got no problems.
right. Or we don't want the school or the mental health professional, and this is their favorite word right now, isn't it, Chris? Indoctrinating our kids.
Yeah.
Well, it really is. It's a shame. And I will say from my standpoint, my daughter struggled this past school year, and without having a real, and she was a social worker. I don't think she was an LPC, a licensed professional counselor, but she was a social worker that had
That's fine.
background in school psychology. We're lucky and fortunate that her high school separated those jobs out.
Yeah,
But that's
you
because
are.
these independent schools make that independent decision on how they're going to staff themselves. We have had bills in the past to make sure that anybody who is at a school with an LPC or a social work background or degree only did those things.
Right.
It's pretty hard to enforce that, but I totally agree. And we had, I think, and I said earlier, there weren't efforts to focus on mental health, but that's not quite true, that there are mental health efforts, but not necessarily because of Uvalde, these mental health concerns with school kids have been there for a while. And from my own family's need, TCHAT, and I can't remember what the acronym stands for, but the TCHAT program was how we accessed professional help when everywhere else there was just a waiting list. And the TCHAT program is a program that the school district then coordinates with a group of providers who are, most of them psychologists or psychiatrists, or maybe both. There's usually a care team. And that TCHAT program may be a way for us to make sure that even if the school district doesn't have somebody that's well-trained or thoughtful or knowledgeable, that they can then refer them to TCHAT, which allows that student and their family to then have access to a whole lot of mental health care. I'll be working on that personally, just because, again, it saved our family last year. So that is something
That's
to
a great idea.
think of. If you look it up, TCHAT is just it's a fantastic program, but Jolene pointed out, like social emotional learning, calling it SEL and using things like DBT, dialectical behavior therapy. These acronyms sometimes get lumped into the CRT or the, the other issues that seem to be more red meat for certain people who don't want schools acting as healthcare or mental health care, pardon me. So we're going to have to work on that, but TCHAT's been fantastic. And I think there is an understanding that it's a fantastic program that's out there and expanding. And I'll be working on that. So,
well, I mentioned LPC specifically because I am one, but I don't care if it's a social worker, a LPC account, somebody who's licensed and professionally able to work with students. And the other thing too is that you have to deal with the attitude however you can to let other students know they're not crazy, they're not, they're just dealing with those kind of things. It's like, people around blindness, for example, or other disabilities, they get all weirded out because they don't know how to treat people like people.
I think COVID has changed a lot about how we look at the mental health of school children. And when I use the word children, I mean young adults as well.
Right.
And certainly I think that group of kids that are coming up, they're so well informed and they seem to be understanding more about how to talk about their mental health. And Jolene may have some comments on this, not to pull the whole conversation to that, but I am hopeful and I am encouraged by what I've seen in the last couple of years dealing with my family's struggles, my daughter struggles, to think that this next group of kids that are coming up, they're so smart and they do understand that they have to take care of their mental health instead of what my generation did, which just bottle it up and shut your mouth. I think there is hope for that, Glenda.
That's
really
good.
That's good to know.
Yeah, that's good to hear.
Yeah.
Yeah, as an LPC also, I'm very aware of how much of a struggle it is for LPC schools to do their jobs because there's so many other requirements. They just really aren't given the time or the space, and then the students don't have the time and space either. All I'm saying is that I have supervised, I'm a supervisor of interns, and I have had interns in the school system trying to do LPC work. And it's not only their time restraints, it's the time restraints of the kids. They have kids doing so many other things that there's really there's not quality time for students and counselors often to get together, maybe 10 or 15 minutes at a time. So I think maybe, if they could even look at how to arrange for mental health services outside of the school day. I don't know if that's been looked at or not.